You finally went to your doctor. You got the blood work done. You waited for the results, and then you hear it. Everything looks normal, but something doesn't sit right. You are still tired. Your energy isn't what it used to be. Your mind just feels a little slower than before. So you start wondering, if everything is normal, why don't I feel normal? Here's the question most people don't think to ask. What if normal isn't telling the full story? In clinical practice, this is something I see more often than you might expect. Most people assume that normal means healthy, but that is not actually how lab ranges work.
These are population averages, not optimal health targets.
Most lab results are based on what's called a reference range. But here's what that really means. Your results are being compared to the general population. And that population includes people who are already metabolically unhealthy, already developing chronic disease, or already on medications. So let me ask you this. Is that really the standard you want to measure your health against?
Most chronic conditions don't start when labs become abnormal. They start years earlier. There's a window, often invisible, where your body is already compensating, adapting, struggling, but your labs haven't crossed that threshold yet. And this is where many people are missed. This is where symptoms begin, such as fatigue, brain fog, weight changes, but no clear answers.
Let's take something very common. Blood sugar. You may have been told your glucose is normal, but what is often not checked is the insulin level. Think about it. Long before blood sugar rises, your body may already be resistant to insulin. And here is the part most people don't realize.
By the time glucose becomes abnormal, this process has often been developing for years.
One of the patterns I notice is patients feeling frustrated because they know something is off, but the labs don't reflect it yet.
Now think about your brain. You may notice subtle changes, forgetting names, losing focus, feeling mentally slower, but standard labs may still appear normal. One overlooked factor, vitamin B12.
You see, even levels within the normal range of this vitamin may not be optimal for brain function. And in some cases, symptoms of vitamin B12 deficiency can look very similar to early cognitive decline.
Now consider your sleep. You wake up tired even after a full night rest.
But routine labs don't measure sleep quality, cortisol rhythm, or stress adaptation, factors that could affect your sleep quality. So the question becomes, what happens when the problem isn't in the labs, but in the system itself? Remember, your metabolism, brain, hormones, and muscles don't function separately.
They are deeply connected. So when you feel off, it may not be one abnormal number. It may be a pattern, a trend, or a shift.
One thing I always tell my patients is this: we don't just treat lab values, we treat people. And often the symptoms show up before anything changes on the labs. So, if you have ever been told that everything looks normal, but you don't feel normal, it's worth paying attention, because catching these patterns early can actually change the course of your health. If you find this helpful, consider subscribing for more physician-led, science-based insights on aging and health.